Right. Right. Yes. So we are today here now with Mr. Sachin Christopher. Sachin Christopher. We are doing the speaking sessions. It um, is that blood transfusion. Okay. Yeah, Sachin, you can start now.
Good morning, Abraham. I'm Christopher, one of the registered nurse working in this casualty ward. And how can I assist you?
Yeah, actually, I am very anxious and upset, nurse.
Uh, may I know the reason?
Yeah, I know that I was involved in a hospital in a road accident, but I'm not
Yes, yes.
seriously injured. I know that also. Of course, I have lost a lot of blood, and I have been told that I need a blood transfusion. Is that really that important?
Yes, it's absolutely important because you lost a lot of blood during your accident, and where because of that you'll be facing some trouble with your adaptation to that loss. So, so doctors are advised for blood transfusion. And
Okay, I
regarding the blood transfusion, do you have any doubt?
I have no idea what the procedure blood
Mm,
transfusion will involve. And I am
yes.
really anxious about the procedure and the danger of receiving infected blood. I
Mm.
have read in the newspapers and I have watched on the television that people have contracted HIV through blood transfusions, and I don't want to take a risk.
Uh, don't need, you need not to be worried about that because you are in safe hands. And as a part of your concern, you said that a possibility of HIV infection. Is that so?
Yeah, any type of infection, I don't want.
Yes. Yes. Before the first of all, is this the right time to speak with you regarding
Yeah,
the whole
please,
procedure?
please go ahead. I need to know everything. I demand an explanation from you. Everything
Yes, of
involved.
course. Yes, I'm here to help you. And before getting into the topic, you need an blood transfusion, which is a common procedure, but it requires a careful, close monitoring of your vital signs and adverse reactions. You may have some adverse reactions. So it is essential to be a part of intensive care is essential for you. So your blood need to be cross-matched with the donor's blood. So for that, we'll be sending your blood for cross-matching, and the donor blood is being screened for all possibilities of all infections such as HIV, HBsCG, and even malaria, dengue, and these all kind of infections are also screened during the screening. Uh, can you understand that point?
Yes, of course. I can
And
really understand, but
mm,
tell me about the possible risks that are involved and any side effects related to this blood transfusion.
First of all, during the blood transfusion, in the initial 15 to 30 minutes, the blood will be going very slow to rule out and watch out for any possible adverse reactions such as rashes, sudden onset of breathing difficulty, and itching overall the body. These are some minimal side effects, and there are some risks involved. But for a speedy recovery, it is essential to do a blood transfusion as soon as possible.
Okay.
And this blood transfusion will be done in a sterile condition where we'll be shifting you to an intensive care unit, and also every syringe will be new, and a nurse will be closely monitoring your vital signs and your health status during the blood transfusion. And this blood transfusion will be for around 3 hours.
Okay. Right.
Uh,
That's so far
3 hours
so
is
good.
a little bit long period, but that might help you a lot in your recovery. Is that
Yeah.
okay?
Yeah. I have two questions now. First
Yeah.
question is, will my body be
Mm,
ready to accept a foreign blood? That is my big question. And what
mm,
if something goes wrong in the middle of the procedure and
mm.
unforeseen,
Sure.
conditions,
Mm.
complications, then what are you going to take as a remedial action? I want to know these two things.
Yes, sure. I'm here to answer your questions. First of all, blood cross matching will be done where the donor's blood should be same as yours. For example, your blood is O positive and the donor blood should be O positive. We will not accept O negative, which is not a match for your blood. So the blood will be matched with you, and a compatibility card will be provided by blood bank, which means your blood and the donor's blood is matching, and you are fit for blood transfusion. And after that, if you're having any adverse reaction, a nurse will be there watching you closely, and the doctor also will be available uh, if needed. And in case if you have any allergic reactions, we'll be administering some medications like Avil and hydrocortisone if needed. And you will not face more difficulty during the blood transfusion. And are we on the same point?
Yeah, of course. Nurse, thank you very much. Now I am little bit confident regarding your methods and blood transfusion. So
And
I
that's
agree
really
for
great.
that. I agree for blood transfusion.
That's really great, Abraham. And
Yes.
do you have any other concern apart from this?
No, nurse. Thank you very much. But if in case in the middle of the transfusion, if I have any problem, I'll convey you. So immediately respond because I am little bit scared still.
Yes, sure. I'm here to help you. Don't worry about that. And have a speedy recovery, Abraham.
Thank you very much, nurse.
Thank you.
So Sachin Christopher, here is your list. Now, first one is in the beginning, you're not very confident. I don't know why. Maybe after a good long break. So that's the reason why I ask to do regularly. I ask you to do regularly. That is the main reason I ask you to do regularly. Number one. Number two, pauses and breaks were too many in the initial 2 minutes. Pauses and breaks, and ultimately unnecessary sounds also like in the beginning they were there. Slowly you recover from that from the 3rd minute onwards. You said doctors are advised to have something. Doctors are advised to have blood transfusion. That's what you meant.
Mm.
Doctors are advised, or doctors advised.
Doctors
Doctors
have
advised.
advised. Doctors
Doctors
advised.
have advised, or doctors
Mm.
advised, or you are advised, or you have been advised, or many different ways of speaking. But the thing is, you said doctors are advised. That means who advised the doctors? Doctors are advised. You mean doctors are the patients, or there is somebody else, a higher authority, to advise the doctors? What do you mean by that? There was a mistake. Doctors advised, or doctors have advised if it is present tense, doctors advise if it is in past tense, or you are advised in the present tense. Okay, or you have been advised in the present perfect tense, or you were advised in the past tense. All are correct, no problem regarding based on the tense you speak. You can speak there. Then idea generation is a bit slow. Idea generation is a bit slow. You are not able to get your new ideas on the spot. Spontaneously generating ideas is very crucial, especially in the speaking. In writing, at least you can get back to it, erase and write. But in speaking,
Mm.
you will be dumbstruck. Okay. So you have to be a little careful. You have to generate ideas very fast. The next one,
Mm.
mild hesitation is there when you are speaking, to speak or not to speak. What if there is a mistake like that? So that confusion, that panic, that hesitation, whether or not that 2 3 seconds pass is troubling you a little bit. So next one, the confidence
Mm.
level was a little bit lower today. I don't know why. Maybe because of your night duty and post night duty hang. Maybe because of that. Right. So sleep. Maybe something, whatever. But problem is
Mm.
there definitely. That low confidence. Because earlier you spoke very nicely. I remember that. Plot construction is good, but not definitely excellent. You have to improve in that area. How you are devising your plan, step by step, you have to construct, and the idea should go after another without any hesitation. Subject knowledge is excellent, but how to use that subject knowledge is an art. Okay, you have to skillfully develop that. If you are having any doubts, if you are having if you are having means now, if you have any doubts is better. Simple present tense, not present continuous tense, simple present. If you have any doubts, you can ask me. If you have any doubts, okay, not if you are having any doubts. If you have any doubts, you can ask me. I'm ready to help you. And you said avil and hydrocortisone, and you said is needed. Avil and hydrocortisone is
If
needed.
needed.
If needed, I heard like is
Yes.
needed. Okay, fine. If it is if needed, it's correct. But is needed means it's wrong. Okay.
Mm.
Avil and hydrocortisone, or avil or hydrocortisone. I have one more confusion there. I- Avil and hydrocortisone, or either avil or hydrocortisone. Any one is enough, or both are needed?
Both are needed, sir.
Both are needed. Together you
Yes, sir.
have to take. Is that so?
Yes, sir.
Then fine. One is needed, then or. Both are needed, then it should be and. Then if both are needed, it is right. Otherwise, it's wrong. Right. That's very nice. You have done a good job. You have done well. That's a good speaking session, but I cannot say it's better than the previous one. It's definitely not that quality like a previous one, which you have done. I'm not comparing with others. I'm comparing your speaking session with your own. So better
Okay, sir.
practice regularly. Do you have anything to speak?
That's it, sir.
Yeah, fine.
I
So
wanted
you,
letter
mm,
correction. That's
yeah,
nothing
letter
more.
correction you told tomorrow you want, because today you are little
Yeah.
busy, you told, no? No problem. You give
Yes.
me your time and the day,
Okay,
then
sir.
I'll correct it. Okay. Write the name of the
Okay.
letter, tag that one, and write a time and date there, and I will schedule the time accordingly. Right. So, how was
Okay,
the
sir.
feedback? What do you feel regarding the feedback? Any suggestions were beneficial? You can comment on the feedback.
I feel good, sir. Like, I'm getting good feedbacks, in detail feedback regarding my speaking sessions.
Yeah, that's good. Thank you very much. See you again.
Mm. Thank you, sir.
Right.